My case presentation, I would like to introduce today a 43-year-old patient who did a refractive lens exchange followed by LASIK 1 year ago for correction of her residual error. Then she came after complaining from drop of vision in her left eye. Her doctor was diagnosed here as a corneal abscess. Her visual acuity on time on presentation was counting finger 5 meters. This is her photo from the slit lamp. On examination, I didn't find a corneal abscess instead of a huge post-LASIK epithelial ingrowth. So I decided to lift up the flap and dealing with the interface. I started the surgery by marking the cornea. Then by using a Saniski hook, I was able to identify the edge of the flap. Here I am intending to elevate only the 180 degree part which involving the ingrowth, not elevating the whole flap. Then by using a cyclolysis spatula, I am trying to dissect the flap from the underneath stroma. Be careful and take your time in this crucial step. And the most importantly here is to push down during dissection, to push down toward the stroma, to not make a hole in the flap. As if you lift up the spatula toward the flap, it's easy to make a hole, which needless to say, it's undesirable. You can go through by the spatula from the other side or from one side. Here an area of macrostria, which will be dealt with later on this video. Again, take your time in this crucial step. Once the flap is mobilized, now I was able to elevate the flap and dealing with the interface. As you see, the stromal bed, there is a significant cells, epithelial cells at the stromal bed. By using a hooky knife, I am trying to scrap the stromal bed. And the most important also step here is to also scrap the intact epithelium from the edges, as this allows a better adhesion for the flap post-operatively, so decrease the chances of recurrences. Scrap carefully but aggressively enough to remove the whole cells. Then I will try to scrap the underneath of the posterior surface of the flap. I'm trying to support the flap with a sponge, then with the hooky knife, gently scrubbing to the posterior surface, especially the edges of the flap. Now I'm applying alcohol, 70% absolute alcohol for 15 seconds, followed by mitomycin C, 0.02% for another 15 seconds. Then copious irrigation, irrigate and irrigate again. Then drying the stromal bed and drying the posterior surface of the flap. Now I was able to bring back the flap to the original position, and using the distilled water at the interface to remove any debris or cells, and also to treat this macrostria by massaging or ironing or milking of the cornea. Usually in mild cases like this, in mild cases we use a contact lens, but in severe cases such this case, I decided to take a 7 multiple interrupted 10-0 nylon sutures. And when you are taking the decision to take sutures in such cases, you may like to tighten the sutures more tight than usual. Also to not allow any recurrence post-operatively, and to close any track for the epithelial cells to migrate again to the interface. Now burying the nodes. 2 minutes, please. And putting the contact lens. This was the post-operative results, the first day post-op, and I removed the sutures, whole sutures, 6 weeks later. This was the refraction of the patient. It was high cylinder, about 6 cylinder pre-operatively, and post-operative with suture on, and post-operative with after removal of the suture, you can notice the dramatic decrease of the astigmatism. This is the paper that I follow in management in this case. Actually, this paper published at Journal of Cataract and Refractive Surgery at 2017 by Dr. Doa, but I used multiple interrupted suture instead of fibrin glue. My take-home messages: make your interface well and identify the edge. Be gentle and take your time in dissection. Remove the epithelium from the edges. Consider taking sutures in severe cases, and the most importantly, only treat the visually significant cases, as this patient also has an epithelial ingrowth in her right eye, but her vision was good, so I decided to not interfere. Thank you, and that's all for you.